welcome to this session of the program. We'll be talking health. Health, they say, is wealth. Now, on March 23 was World Optometry Day. Day set aside to celebrate people who are professionals when it comes to the eyes, and it was also a day for them to create awareness on issues affecting the eyes. Joining me this morning, since it's been a week-long program, joining me this morning, I have the Chief Optometrist with the State Ministry of Health, Dr. Ejitui Song. Thanks for joining us this morning.
Thank you, Mercy.
Okay.
It's my pleasure.
Now, some of us, some people, we seem to take the gift of sight for granted. We seem not to care so much about the eyes till we get infected. Now, first of all, I'd love for you to start from, from the basics. How do we take care of our eyes?
You're very correct in saying that people find it difficult to care for their eyes. The eye is one of the most neglected organs in the body. When people have headache, they look for what to do. But when people have problems, they don't until it's so bad. When it's almost irredeemable, that's when they remember the eye doctors. But it's very important that we care for our eyes, because the eye is the most important organ after the brain. And 50% of the information the brain processes is eye related. You can imagine a whole body, and 50% of the connections are just one organ. So that organ is not an organ that should be neglected by anybody. And when you discover that a blind man can hardly perform the normal functions to help you develop a healthy life, your career, your day-to-day activities, without vision, all those functions become very, very difficult. So people should care for their eyes. If we realize again that the eye is about the last sense to be developed when a child is conceived, by between the third week of fetal life and the 10th week, that's when the eye begins to develop. But it's such an important organ that affects about 80% of learning. So we should care for our eyes. The first eye care tip is to give priority to the eye. I would say that's the first. If we discover and we realize and we know that the eye is important, let's give it that priority. Not to wait until something happens to the eye. The next thing we need to do about the eye is not to treat the eye in isolation. The eye doesn't work in isolation. Like I started, if it is 50% of brain activity goes to the eye, then we know that there are many interconnecting systems that have to do with the eye. So you take care of your general health. In taking care of your general health, you'll be taking care of the eye by what you eat, making sure that you're eating good food, nutritious food, balanced food, And in maintaining a healthy weight, that's another thing you need to do. You need to maintain a healthy weight, because an overweight person is putting pressure on the other organs of the body, which will in turn, come back to the eye. Because if you're overweight, you'll be prone to hypertension, you'll be prone to diabetes, and those are like risk factors for eye health.
Okay.
So a normal weight is something that we should do as an eye care tip. We'll be preventing things like cataract and macular degeneration, all those things that make vision to become blurred, or give us some level of poor vision. There are many other things that we need to do. Smoking.
Okay.
Smoking is something that anybody who wants to have good vision, should try as much as possible not to indulge in. because what smoking does to the system is to deprive the system of oxygen. And every cell in your body needs oxygen. So if you are destroying, depriving the cells of oxygen by smoking, you are virtually telling the organs or the cells, the systems, you can die. So smoking is one particular habit that is not good for health, and especially eye health. The other thing we need to do is to give our eyes protection. There are many radiations. We are an IT age. Many of us are involved with so many, gadgets.
Yeah.
We each have a computer, whether we have the desktop or the whatever. Our phones. There's hardly any family where you don't have phones, and our eyes are on it. COVID came to compound the way we learn. So everybody is on the system. So there's a need for eye protection, not to overuse the eye on those systems, because they'll get your eyes tired, they'll get your eyes, affected by radiations and so on. So you give some breaks. The way we use our systems will help us manage our eyes well or not. And there's still so many others, but let me give you a chance to, so we can go to some other things.
All right, I'll come back to talk about some of the basic eye infections we have around. But you mentioned the baby developing in the womb. Sometimes we find out that some people are born blind. What could be the cause for such cases?
A child born with cataract will not see. And I've been in a situation where somebody say, do children have cataracts? I say, yes, children can be born with cataract. Rubella is one cause of cataract in children. And that's why it's important that, girls especially are immunized against rubella. Because for a young lady who did not have rubella vaccination, you may make your child to have cataract. So while the baby is developing, in the womb, there are certain things that they could pick up. And one other thing is that, the mother who is eating well, like I talked of smoking, a mother who is pregnant and is smoking is predisposing the child to, the parts of the eye that will develop and, make the child to see well, not to develop properly. So while you are protecting yourself, you are actually protecting your unborn child too. So the habits we have could mar or make the developing baby. It's just also like a woman who who drinks alcohol a lot. You'll be jeopardizing the chances of that child developing well.
Okay. Okay. Now, is there any way the genes can also affect the child in the womb? Perhaps the father or the mother is blind, and the child comes out blind. Is that also possible?
Yes, there are genetic factors, and that's an area of eye care that is, going through a lot of research. Right now, there are researches to see how genes could be used by, working on the genes. You can take care of some eye diseases. Yes, genes do affect. We know one instance of genetic predisposition to eye problem, like the albino. It's a genetic thing transferred, especially from the mother to the child, or they run in families. Glaucoma is another thing, and there's a lot of gene research going on about glaucoma, and several other factors. You have children with Down syndrome and so on, they're all something just goes wrong with one gene and the child is affected. So gene factor is very important. Sometimes you have people, who are very highly myopic, and maybe you get another person with very high myopia as your wife. The tendency for your children to be very highly myopic. So there's a lot that eye health has to do with genetic factors. And several other things.
Now, can you kind of list out some of the basic eye infections?
Let me start. There are many. Let me start with the common ones. the most common that is everywhere is conjunctivitis.
Okay.
You know, the one that makes your eye red and bring out pus. The one that happens usually during certain seasons.
The one we call Apollo.
The one we call Apollo.
Okay.
So that's a very common one. We also have some other infections that make the eyes to water and itch. Those ones come as a result. We call that one, it's still conjunctivitis, but it's an allergic type.
Okay.
That comes from something you're allergic to, which could be food, which could be soap, things you use in your body, and so on. There are still the others that come from, you know, the child being born, you know, and there's a lot of pus.
Okay.
We call it that come from the gonococcus infection. A woman who has whatever, and the child is born with a lot of pus. The eyes are puffy, the eye is closed. We also have a trachoma,
Okay.
which has to do with, you know, infection from bad, dirty environment, the flies that perch on things. So trachoma is one other infection that can affect the eye, and several others.
Okay.
So that's why it's not right that you have an infection and you begin to treat, because you may not know which particular one. So when you go to the doctor, sometimes they may have to do some laboratory tests to know which particular antibiotic or so will be appropriate for that.
Okay. Okay. So basically, what are the warning signs one would notice? What are the symptoms and signs that could be noticed
For an infection.
For an infection.
For an infection, one of the eye could be swollen. There may be a discharge. There may be some kind of itching. Then the eye could be red. The characteristic of the redness differs from one kind of infection to the other. So, like the infection of a bacterial infection will be different from the coloration of the viral infection. Okay. So redness, inflammation, discharge, and pain. Those are some of the characteristics that you will see with infections.
Okay. Now you've just mentioned some classes, the viral and the bacterial types of infections. Can you differentiate the two? Explain them to us.
Okay, when you have a bacterial infection, it's most likely you will have a discharge. That is a mucus discharge.
Okay.
But when you have a viral infection, you may not have a mucus discharge. You will may have a watery discharge and some kind of discomfort. The pain may be more in viral than in bacteria.
Okay.
Then you may, in allergic infection, you may not have discharge, but you will have watering, you have itching.
Okay.
To differentiate between the viral and the allergic, the difference between them is the itching. You may not have itching in viral, but you have itching in allergic.
Okay.
So those are some of the differentiating factors.
Okay. Now, sometimes we observe that, for instance, when someone has conjunctivitis, and you observe that so many people might have it within that period, could that be said to be a viral infection at that period?
When we say viral, many people having it. You can have a bacterial infection that many people have. Okay. You can have a viral at a particular time that many people have. It depends on where. If it's airborne, many people will have it without contact. Okay. If it's due to hygiene, like the bacterial ones, in families, you know, where people use things in common, you know, somebody is using a towel, the other person in the family is using the towel, so the infection is transmitted from those surfaces. Or somebody removes, you know, some discharge from the eye and drops it on the table without washing our hands. You know, COVID has taught us a lot. So hygiene is very important in managing infection.
Okay.
So to avoid, many people not having it, everybody has to take responsibility for a hygienic environment.
Okay. Okay, since we're talking on general terms, we're not specific. We don't want to today set the day aside for a particular type of infection.
Okay.
I'd love to know the treatments available, how people can go about, you know, after noticing the warning signs and the symptoms and being diagnosed. What's the next step?
Okay. Well, like I mentioned, having a clean habit. The first thing in towards treatment is to reduce the load, to reduce the either viral load or the bacterial load or the allergen. So washing your eyes with clean water is a very first step. When you come to the eye, you see somebody with bacteria and to the hospital, to the clinic. The first thing, even before applying the drug, the antibiotic, is to have an eye wash.
Okay.
So keeping the eyes clean, you see somebody wake up in the morning, if it's a bacterial infection, the whole lids are gummed together. The first thing is to wash. If you don't wash, no matter what treatment you are giving, the effectiveness, because the viral load, the bacterial load will be so much, overpower the drug treatment you are being. So that's one first thing, to maintain, to wash the eye
With water.
with water. Then you apply your drugs. Then you also have to be able to, not reinfect by keeping your environment clean. Because what's the point? You finish treating and you're just going back to another, source of the infection.
Okay.
You come up with it again. Then, there's something about nutrition that helps your body to heal itself. Okay. So you must eat well also, so that your body is able to fight the infection, even though it's an infection in the eye. But somebody with greater immunity will not often fall to infection. Okay. So that's where eating well comes in. And giving your body rest. All those improve your immunity. So those are some of the first steps that we'll need to do. Then that is not the other thing is to take yourself to the hospital, to the clinic, to the professionals who are able to differentiate and know, like we said, this is the kind of treatment that goes for this particular kind of infection, and not to self-medicate. What we see people do is, once there is an infection, the first port of call is go to the chemist and say, I have this. And many times, the treatment is not appropriate. So take yourself to the professionals, to the eye clinic, and let the people who are trained to differentiate be able to, treat you and give you the correct medication or advice.
Okay. Now, how does certain conditions degenerate to a point where, sometimes people become blind, lose their eyes and all of that?
A stitch in time, they say, saves 9. You have 10 stitches and they start loosening, and you're waiting till the 9th stitch is off. The dress will tear completely. But if by the time the first stitch is loose, you rectify it, the possibility and probability of saving that dress is high. It's the same with the eye. Prevention is better than cure. If we do the things we have said, and by chance you have an eye problem, the next thing you need to do is to seek treatment early. Early intervention. Presenting yourself when the condition has not deteriorated. Because once it's not discovered, for many eye problems, you may not know, the seriousness, because something like glaucoma will not give you any sign until it has gone very far. And then you present yourself. There's no magic that the doctor is going to perform. So early treatment, presenting yourself for regular eye checks. Don't wait until you have a problem in your eye. The eye is one organ that you should maintain. In fact, like every other system that we maintain, do your health checks. Make sure that at least once in a year, you know what your blood pressure is. you know what your blood sugar level is. You know what you know other functions of organs in your body, what they look like. By so doing, by presenting yourself, you'll be saving yourself a lot of trouble. And then once a year at least, you should have a comprehensive eye examination to know if there is any problem. The doctor will let you know, and then treatment is started early. And again, if there are prescriptions given to you, it's good to follow the instructions, the prescriptions as they were prescribed.
Okay.
Sometimes people are giving drugs and they are report back in 1 month and you don't ever see them. The next time they are coming to you, they will tell you, doctor, I didn't know I was to come back. Sometimes you make calls and they are saying, I didn't have any problem. These people just want to eat my money. No, it's not exactly so. It's in the interest of anybody to keep appointments that are given, because the doctor wants to monitor what's going on and give you the correct advice.
Okay. I'm sure you're eager to say more. We'll have you again, so you can still talk to us about how we can care for our eyes, which they say is the light of the body. Now, one final question in just a sentence: whom should we go to? Sometimes people go to ophthalmologists, and then we have the optometrists for eye issues. Who should we go to?
Before I answer your question, there's one last thing I must say.
Okay.
That you must know your family history in trying to, maintain good vision. You must know what runs in your family, because those things that run in your family could become risk factors.
Okay.
And when it comes to eye care, it's a teamwork. It's only people who don't know who will be struggling. This is the ophthalmologist, this is the optometrist, this is the what. Everybody is important. I used to tell people, even the cleaner is important. But the optometrist is the first person you should present to, when you have an eye problem, because the training is such that he's able to tell you what should go to the ophthalmologist as a surgeon, what should be in the primary care. Before you even come to the optometrist, most times it's because the primary care level cannot manage it. So your optometrist is in a good position to refer you to other professionals. The optometrist is able to liaise with the school, the people in the schools. I had talked of Down syndrome also. The optometry is able to work with the neurosurgeons when you have problems that have to do with double vision, that has to do with brain work, and the ones that need surgery. So it's a good idea to present yourself to the optometrist and be seen, and then referred to the various categories of stakeholders in eye care.
Okay. All right. So we've been having some tips there on how to take care of our eyes. The eyes, I say, is the window, is the light of the body. Very, very important organ of the body. And I've had with me the chief optometrist in the Ministry of Health, in the State Ministry of Health, Dr. Ejitu Mfonisong. Thank you so much, ma'am, for being part of the program. All right. Okay, on this note, we've come full cycle on Centerpoint AM 45. Want to say thank you so very much for having been part of the program. Join us next week, Wednesday, for another exciting edition. On behalf of the entire crew, including my colleague Samuel Oyara, thank you so much. Do have a blessed day.